After her death, this woman unexpectedly traveled to the modern world. She began learning medicine, and after becoming a top doctor, she found herself back in her former world. This time, she chose not to be the useless queen anymore. Instead, she decided to become a great doctor. Everyone thought Alice was joking. To make her face reality, Alice was assigned to the hardest hospital. No one had any hope for her. They told her to go back home, and even the doctors thought she was just playing around. Lauren looked at his pocket watch. The time on the report was 10 o'clock. If she was even a minute late, Alice would be kicked out. At exactly 10 o'clock, there was a knock at the door. Alice walked in. Lauren asked for basic information. When he learned that Alice had taught herself medicine, he couldn't help but laugh. If it weren't for the Earl's arrangement, he would have kicked her out already. He asked a harsh question. If a patient dies during treatment, how would she handle it? Alice replied, "I would keep the patient in my heart." She answered like a seasoned doctor, as if she had witnessed countless patient deaths. So Lauren took her to the ward. The patients were mostly seriously ill and incurable. Alice asked Lauren, "Should we treat the underlying disease or go with conservative care?" Lauren told her to do her best, but never to pretend to know what she didn't. However, those patients were almost dead. Lauren hoped she could face reality. And the ward, along with Alice's attire, was a stark contrast to the dirty, chaotic environment. Not trusted by anyone, Alice decided to clean the ward first, since a clean environment could effectively lower the mortality rate. The nurses, eager to help, quickly transformed the ward. At that moment, a patient groaned in pain. He had fallen while repairing a roof, fracturing his ribs. He had been bedridden for a long time, developing bedsores on his back. The patient's critical condition made Alice prepare for immediate treatment, instructing the nurses to prepare the operating room. She would handle it herself, and those around her were uneasy. However, Alice hesitated not at all, calmly preparing for surgery. The nurses were somewhat hesitant, but they knew there was no time to delay. Her hands were as steady as a rock, and modern medicine allowed her to perform the treatment effortlessly. After the surgery, the patient recovered well. This treatment made all the patients in the ward believe in Alice.